tonight, or for this session, we've got a wonderful guest. Mark Jinks is here. He's city manager of the city of Alexandria, and we're delighted that we probably have more information from him than we have time, but we'll see what we can do by way of showing how the city relates to seniors in Alexandria. But Mark, before we begin with that, maybe you could give us just a little bit of background. How on earth did you wind up being city manager of Alexandria? I know you've got a vast background, but we'll let the folks know how you got here.
Well, it's a long career story. I've worked for state and local government for 40 years, almost all of that in Northern Virginia, in Arlington, and then in Alexandria. We're in Alexandria. My first 10 years was the chief financial officer, and then gradually I picked up additional responsibilities, and finally the ultimate responsibility administratively, and that as city manager, and that started in January.
Well, congratulations on your appointment, and you've come in at an era in which maybe that's the nature of the job, but there's plenty of issues on the plate, but we look forward to your service and appreciate that. Tell us a little bit about how you see seniors in Alexandria. What's affecting what needs do they have? What's the proportion of them? How do you see it from a city perspective?
The seniors are very important to the fabric of the city of Alexandria. Many of them have spent a lot of their lives in Alexandria. They devoted a lot of time and effort to the community, and they're valuable. And we want seniors to stay in the community and live independently as long as they can. And what we're seeing in the community, like many communities, we're seeing the number of seniors growing. And we're seeing the average age of seniors get older. People are living longer, and that's good. The flip side of that is that people age in their homes longer. Their needs change. Their needs increase. The resource, if they're not able to live in their home, the resource needs in the community change and increase. And so the community is the city government and the nonprofit sector, including senior services, are, we periodically and update our plans, and we have to adapt to a changing and growing population.
How does the city formulate policy? Is there a function of city council, staff? Are there boards and commissions? How are those needs identified, and how do you craft ways to begin to deal with them?
Well, while ultimately City Council sets the policy, City Council adopts the budget, which in fact sets the resources that are available for seniors, there are a lot of other people involved, as is the norm, the Alexandria way, if you will, of lots of participation in setting policy. So we have commissions, we have nonprofits, they have boards of directors, and I think if you counted them all up, you have dozens and dozens of people, maybe 50, 75 people involved from the citizen point of view of helping set and recommend policy. City staff, we help craft the details, and our responsibility is to implement it, the policies that City Council adopts. So, for example, there are basically a strategic plan for seniors that was developed with lots of input from the senior community and from the nonprofit stakeholders. Our major policies like that are subject to public hearing, and then City Council adopts them. They then become part of the city's overall strategic plan, and we have a city strategic plan that picks up elements of strategic plans that are land use related, strategic plans that are related to urban forestry or children and families. And from that we say, what are the most important things that we want to focus on, and then use the annual budget process as a way of saying, what resources do we have, what are our priorities, and where should the money go?
Two things strike me. Can you recall what some of the priority issues were that were identified out of that process? What are the hot buttons relating to seniors from your perspective?
Well, I think having seniors be able to live in Alexandria for a longer period of time.
In their homes?
In their homes or in institutional settings.
Okay.
Such as independent living or multi-step facilities. We have in Alexandria a lot of senior facilities, but they tend to be senior facilities for those who basically can afford to pay the full cost. What we don't have is an adequate number of, say, beds or an adequate number of apartments that can serve those in kind of the middle income, lower income levels. We've got the very low income, Ladre and Annie B. Rose in Old Town. We have Claridge House, but we don't have enough places for people of low and moderate income means to live in the city. So that's one of the challenges that's being looked at. The other one is, how do you get people to provide them the support they need to be able to stay in their homes as long as it's feasible, as long as it's safe for them to do so? Because most people, that's their preference.
They lose the ability to be totally independent or self-sufficient, and therefore there's a need for a variety of services, but it's not clear who delivers them, if there's a cost, how they be in touch with those. Is that part of the issue?
That's part of the dilemma, is we don't sometimes know where to go until we actually need the service, because we don't think about it. And particularly as we age, we tend not to think beyond today in regards to our abilities and capabilities and resources available to us. And so it's one of the reasons we have a guide for seniors living in Alexandria that's available at city libraries, and that we have information referral that's available through the Department of Community Human Services and Senior Services as well.
Okay.
And so the ways that seniors can find the city's website or Senior Services website, there are plenty of places to find out the information, or people who are available to call and ask the detailed questions that may not be clear by looking at a website or looking at a brochure.
Are there any gaps in that? Sounds like you cover a lot of different venues and providing information with a lot of different programs. Anything that you can think of that is an area of need or that might be a gap in that?
Affordable housing is the biggest
hard.
one. And that is also affordable housing for not just seniors, but moderate income families, low income families. We in the city have been working to increase that, but the market is such that every time we get 200 units, we lose more than 200 units to the market. So we continue to work on that. That's a long-term solution. We provide real estate tax relief for seniors and for the disabled as a way to be able to afford to stay in their homes. Sometimes the real estate tax payment that's their house payment, because the mortgage is paid off, or the mortgage is a very low amount, because houses, when many people purchase them, were a lot less expensive than they are today. So that's one way. Some people would like that program to be increased. We have services to low-income seniors and home care. It's only for very low-income seniors, and so the folks of moderate income that are not eligible for Medicaid, in at least some of the Medicaid services, and so we're kind of gap filling. But there's clearly more the government can do. We have limited resources, so we have to look at the needs of the school system, the needs of neighborhoods and services for all city residents, and try to find out what the right balance is and how much money that we can provide for specialized services like senior services.
What I would expect that seniors probably, well, one, they're older, but in terms of being well-educated and participate more, do you find that seniors are disproportionately active or involved in policy making relative to other, families or young people or singles or other components of the population?
Well, I think probably what we find is probably I wouldn't call it disproportionate, but a greater percentage, because it's a good thing when anybody participates, and I would say is that what the younger populations, lower income populations, tend not to participate as much as we'd like them to, and so seniors and folks in the 30 to senior range we see a higher level of participation,
Okay.
which is good. I mean, it's a way of, how do we find a channel that participation, and how do we, when we are looking at issues like assisted care facility on King Street that was subject of community debate, how do we do outreach when those proposals and issues are being considered, so the seniors and the rest of the community can better weigh in on to City Council on whether they think something's a good idea or not a good idea or ought to be amended in some way.
You mentioned accessibility might be an issue. How does that work?
In addition to the affordability we talked about.
I'm sorry, affordability.
The affordability we talked about, there's also accessibility, and it's both meeting, having enough units that are physically accessible to seniors who may have limited physical capabilities. But it's also just practically having types of units in the city that appeal to seniors. Alexandria has probably almost more townhouses per capita than a lot of other places. And a lot of seniors or people who are baby boomers who are retiring into the city are looking for places to live. And one of the things that we've not had in particularly eastern parts of the city are single level units.
Right.
And what we're seeing now is we've had one, and we're having, I think there are 3 more in the works, conversions of office buildings.
Oh.
To basically one level condo buildings. So there's additional product if people want to live. These are mostly North Old Town, and so if that's a neighborhood that appeals to them, there's been limited availability of product. And now with the demand there, developers are seeing that that's a higher and better economic use for the owners of the building rather than as an old office building, turning it into a new single level condominium.
Is that required by city code, or is it voluntary, and is it driven by market forces or by regulation?
It's really by market forces,
Okay.
where these office buildings no longer meet today's office standards.
Right.
But they're solid steel and concrete buildings, and many of them have good views of the water, or in neighborhoods where people want to live, and as a result, the people who own them are weighing low-income rental as an office, or converted into a condo where there is market demand. And so we're seeing a tilt in that direction. Will give seniors who want to maybe already in Alexandria but are in a townhouse and want something that's a horizontal living in an elevator building. It'll give them more options to be able to stay in the city.
Are you finding people are in Alexandria, remaining in Alexandria, or is there a attraction as a retirement community, as a new component of population, or both?
I think it's both.
Okay.
I haven't seen detailed statistics, but clearly Alexandria's population's been growing. We're seeing a return to the city phenomenon nationally. Alexandria is, I don't know how many best top 10 lists of favorite places to go, most romantic city, most well-read city, one of the 10 top arts destinations in the United States, and so it's a place that people want to live. So we're seeing people in the Washington area who may have been living, let's say, it's a couple that I know lived in Springfield, kids, they're empty nesters, sold the house, bought a unit in Alexandria because they wanted the vibrancy of a real downtown, of an urban area, and therefore they and many others have moved into the city. We're also seeing people, as I mentioned earlier, they're living longer, so and many of them are staying in the homes that they've lived in for decades longer as well.
So those two issues of accessibility and affordability get exacerbated by both existing residents and a new component, sounds like.
All right.
What other programs or other services have you had to make adjustments for that change in population? For example, in transportation, what sorts of things does the city provide or cooperate with private or nonprofits in terms of special needs of seniors?
In regards to largely our efforts have been related to mass transit, providing a good expanded dash bus system that's accessible, improving bus stops. We're spending, there are new ADA requirements on curb cuts, and you'll see throughout the city lots of new curb and gutter work and concrete work, and part of that is to make the access in and off of buses more meet not only the requirement, but in order to provide better accessibility. We started about a year ago, the Potomac Yard Crystal City Transit Way, which is going to provide a rapid transit system, a streetcar kind of system, but it's buses, rubber-tired buses, and the bus is our lower level, and they match the curb, so you go basically step from the curb directly onto the level bus, and you don't have to go up a set of stairs or wait for the bus driver to kneel the bus down for you.
How about in terms of health care and maybe emergency services? What kinds of programs have you had to, or needs have you had to, how have you responded to those?
Well, the case of health care for the low-income elderly, there's been a steady expansion over the last 5 years. The Community Health Services Organization, which is largely federally funded, providing clinics. They've just have expanded, I think, a new facility in Fairfax County. So they have been providing additional services to low-income seniors. In addition, based upon demand, we've changed or amended our recreation programs. One of the things that the current recreation director, Jim Spengler, has been trying to do is try to make the programs more sensitive to market, to what the demand is, whether it's seniors, whether it's millennials, instead of offering the same old programs, trying to find out what is it that seniors want, what in other communities are they seeing if they offered seniors that seniors have signed up for. So that kind of adjustment. So we try, as a city government, whether it's seniors or any other population, to listen and to adjust and to try to make continuous improvements to our programs, so that what's a good program today doesn't either slip back or becomes a better program tomorrow.
Question on affordability. Maybe you could outline what is there in terms of real estate or other taxes that accommodate to senior budgets.
There's real estate tax relief, which provides low and moderate income seniors complete or partial exemption of the real estate taxes. Also, there is a program that allows you to defer payment of the real estate taxes. Not many people like doing that. They'd like their properties without any liens on them, and so therefore they will take advantage of generally of the exemption program only. Those folks also are eligible automatically for car tax relief as well.
Do people take advantage of that? I mean, is that well known among seniors that there's?
We hope so. But it's talking about it on programs like this, I think, can help more people find out about it. It's an entitlement program. So that if the budget office comes to me and says, we've had another 100 people apply this year, it's going to cost us another $200,000. We say we have to go find the money in the budget somewhere. So it's not limited to only the amount budget.
Okay, we're going to run out of time soon, and there's many other programs, I'm sure, that seniors would be interested in learning more about. How do they learn? How do you let seniors know what you do, or how do they connect with you?
Well, there's senior guides that are available at the Alexandria libraries. Clearly websites, and the city's website is alexandriava.gov. And the information's either there. If you need to ask a question, upper right-hand box of our homepage, it says Call, Click, Connect. And that is a simple way to just click on that box, and a inquiry page will show up that you can basically, whether it's a senior issue or any other kind of issue, you can ask a question, you can file a complaint, or ask something to be taken care of, or give City Council your opinion on something. So we try as city government to be accessible to everybody, and we're updating the website soon. It'll have a new look and a new organizational design, so we hope that it, in fact, will be easier to use.
Final question. How do you, what's the relationship with senior services? What's the history and background? in terms of working with senior services programs they do with your support, or
Well, Alexandria,
referrals or joint development of programs?
Alexandria City Government has looked at nonprofit organizations as partners,
Okay.
not as competitors, not as just folks who line up at budget season asking for money, but in effect as another department of the city government, or part of the department if it's human
Which would
services.
leverage your scarce resources with hopefully volunteer time and other organizational capability.
That's absolutely right. I mean, if we've got people who want to help, we'll find a way to make it work. And we also try to balance off. There's some things the nonprofit sector is better at than the governmental sector. But then in our mind, let the nonprofit sector do it. And there's some things government is better doing, and those kind of roles we retain. And sometimes we shift those things back and forth depending on circumstances.
I think as kind of a wrap-up comment, my impression is that the needs are shifting, but you're also working hard both in terms of policy and development of programs to keep up with that or even try to get ahead of it. And I am a senior living in Alexandria for many years, and I can say that the programs are robust and the opportunities are great. It's not a bad place to be a senior.
I think that's
place
right.
to live.
A good place
And
to be a senior.
I think thank you for city government for doing that. So
We're glad to
that very
serve.
much. And we're going to run out of time, but I want to thank you for being with us and your comments and time. And I'm sure that people will take advantage of the contact and be in touch with you. But
We hope
thank
so.
you very much.
Government
Appreciate it.
thrives on getting people's opinions and their ideas.
No, it's not static. You are responsive to the clientele, and it's changing. You're changing with it. I think that's very progressive government. So thank you.
Good. Thank you.